Good morning and welcome to Philadelphia. Phil mentioned having to follow Bill White. I have the challenge of following Phil. And one of the really wonderful things about being part of a recovery community organization is the synergy and the opportunities that we've had to work together. A lot of the work that Phil talked about is a lot of the work that we at PROACT have modeled after, have followed, have collaborated with, have talked about in infinitum. And so I'm not spending my opportunity today to talk about what PROACT does, which is the recovery organization for Southeast Pennsylvania that has been sort of in the hole with the city of Philadelphia as we've moved through this transition journey, transformation journey. I'd like to give you just a little bit of background about who we are. One of the things that I think is really important is that PROACT has grown out of a National Council on Alcoholism and Drug Dependence affiliate. And as an affiliate, it's the Bucks County affiliate, but we cover all 5 counties within Southeast Pennsylvania, which is actually the largest population of the state. I mention that because we have been doing advocacy and recovery support services for the past 31 years. I always say, as I got more and more involved in doing this work, that I'm really doing Marty Mann's work, and some of you in the audience know who Marty Mann was. But when I have read about her life, and she talks about how hard that work was, it's really hard. It's not gotten any easier. And when you're doing that work, it is also incredibly, incredibly rewarding. So being able to see some of the things that have occurred as we have been watching and very much part of this transformation, it's been just very exciting to see. The other thing that I think is really important for those of you who are looking to begin your transformations is that we did have the luxury of being a recovery community. It was a support program back at that time, recipient back in 1998. And that certainly allowed us to do a lot of the foundational work and structural development that has carried us throughout these years. In 1999, we initiated, or were actually asked to, by some members in Philadelphia, and we call our folks members, not recoveries. Some of our members invited us to, come in and start talking about what would a chapter in the city of Philadelphia look like. Well, was that a daunting task? And one of the things we learned very quickly is that the city is a city of neighborhoods. So to develop one organization that was going to meet the needs of the city was very hard. So we did a number of things. We hosted social events. We did a lot of training. We did some health fairs. We provided what we called was a star brunch to sort of highlight recovery in Southeast Pennsylvania. We provided a billboard along 95, which we were really very proud of, that we had a billboard, and we initiated a recovery walk. So we did some things to begin the mobilizing process and to begin getting people engaged in the recovery movement here in the city. And then in January of 2005, we had an opportunity to meet with Dr. Arthur Evans. And we discussed the potential of partnership. And I also, again, need to thank Phil for all of the great work that CCAR did to really indoctrinate or to work with Dr. Evans, so that for us, and I got to tell you, we really sort of met, talked through before this meeting what we were going to say. And we had our brochures and we had all of our stuff together. And he opened the meeting with saying, "I understand what CCAR does, and I'd really like to make sure that we are a partner here in the city of Philadelphia with you." And it was like, whoa, wow, okay. So we sat and we talked about what that might look like and all, and we sort of left that meeting and he talked about his vision, and we were saying, "Well, yeah, that's what we want, yeah." And we both walked, the two of us that were at that meeting sort of walked to the elevator and looked at each other and said, "What do you think? What do you think?" So that sort of went on, and we talked a little bit, and things were perk along in the city, and you know, all of a sudden we had an opportunity to get some money. You know, so they were putting their money where their mouth was with this partnership. And it was really to help us expand some of the work that we were doing within the city. And in January, so if you think about it, from January to October, we all of a sudden had enough foundation here in the city to open an office, which for us, being able to do this work, having an office right in the city really helped to deal with some of the neighborhood issues and some of the other issues that we were doing, because we were now situated within the city of Philadelphia. We became part of the transformation planning committees, and some days we would have to say, you know, who's going where? What are we doing? It got a little frantic at times because so much activity was going on. And sometimes it was exhausting, and sometimes you felt like, well, we're talking about this here, we're talking about this there, we're talking about it here. You know, why don't we just all talk together? But I realized, you know, in stepping back, how incredibly important it was to look at all of the different elements and how they were all taken apart or put apart. One of the things that, as this transformation was going on and how it was going to be rolled out, I thought a wonderful and we were very honored to have the opportunity to co-host a dinner specifically for the recovery community. So we invited 350 people to have a really wonderful dinner. I mean, it was a nice dinner. And for many people, coming to a hotel, having a wonderful dinner, to hear about and to be part of this transformation was certainly a dignity setter and certainly a stigma buster for people. It was just wonderful. I had the honor that night to introduce Bill White. And what I said that night was, when the student's ready, the teacher will come. And that is what I have learned, that the teacher came. And lots of other people, you know, became part of that teaching, but Bill White certainly was part of, a major part in sharing all of the lessons that everyone has learned in doing this movement. And sometimes you would think, well, is this right? Is this right? And then Bill would open his mouth and he would say, yeah, you know, back in wherever it was, they're finding X, Y, Z too. So it was so important to have sort of a litmus test that the recovery communities, other places, were experiencing some of the same things. And I think that that was really what the reality kind of testing on this was really important for us to have. This is a movement that in the city of Philadelphia truly is a top-down movement. It is a grassroots coming up, so we're sort of the grassroots coming up, but it is top-down. And there are activities all over the place to help increase pride, increase value, and the celebration of recovery. I can't tell you how many opportunities there are within the city now to celebrate and honor recovery, and I think that that is also a really important kinds of thing that is happening at the same time that all of these transformations are occurring. And there's an attitude that the recovery community is part of the team. I used to say that when I would be invited to other places, they would say, oh, we forgot to get you to that meeting. Oh, you weren't on it, you weren't remembered? Or, oh, your staff didn't come. Oh, you know, yeah, well, we did forget you. In the city, sometimes they would say, well, when can PROACT meet? You know, when can people from the recovery community be part of this meeting? So it certainly was a different kind of feel. And, you know, we had support at, one of the things I also thought was really interesting is that we had an opportunity to be on some provider agendas, you know, to say what's going on with PROACT, what are some of the things that are happening. And it has been certainly an evolutionary process as that has occurred, but more and more I go to meetings, and when there is an agenda item, providers are all just sort of part of supporting and saying, oh, we can do this or we can do that. Sort of the meeting after the meeting is letting me know that people are really all moving aboard with a lot of this, the things that are engaging and supporting and validating the recovery community. Dr. Evans already talked about the transparency and trust. One of the things that's occurred is that we have a seat on the Office of Addiction Services. Both staff and volunteers are on that organization, and that has certainly been one of the things that has been incredibly important. We were part of planning with the Southeast Mental Health Association, the peer specialist training curriculum, to make sure that the needs of people in recovery from addiction needs were being met, and that the curriculum addressed co-occurring disorders in constructive ways. We were also part of screening potential candidates for employment roles, planning roles and job descriptions for peer specialists, and then eventually evolving it to recovery specialists for drug and alcohol organizations. And we also have a staff member who co-chairs the Consumer and Family Task Force. One of the things that also to increase the visibility and the skills, one of the things that we looked at is that people were being asked to be sitting on committees, but sometimes they were people in recovery who were relatively new in recovery, didn't have a lot of experience in those, and then we would hear, well, they didn't say anything, or they didn't have any, or they didn't show up. So there was a real movement to increase leadership skills within the city, and this Peer Leadership Academy was really important. So it was a 28 or 26-week training to help people increase their leadership skills from the inside out. And they were placed as part of the skill building to have internships within many of the different committees and boards and things across the county, across the city. Dr. Evans talked about parallel processes. PROACT works under Engage, Educate, Activate, and Support, and Mobilize, Collaborate, and Initiate, and that goes very well along with the Align, Coordinate, and Integrate, so we're doing things all in parallel. Some of you got to see the Recovery Center last night. We really did take a road trip. There were staff from BHS, staff from PROACT, and as part of that, we got to look at all 4 of the recovery centers and then said, okay, what do we want for the Philadelphia model? And then identified some people and some leaders to be part of that planning process. And Roland said yesterday, that the role of a bureaucrat was to sit in the back of the bus and pay for the gas, and that is indeed what happened. Phil talked about what a recovery community center looks like. We have piloted one. Some of you got to see it last night. We're very proud of it, but also very proud of the role that the recovery community is taking in operating that center. There's a picture of it. There was asked for a question to ponder was about research and the need. We really need to understand, are there services that are better delivered, recovery support services, by professionals or by someone else, and what are the ones that are really important for the recovery community to, or for peers to be able to deliver. One of the things that you've heard a little bit is the importance of creating a real consumer base. We call them consumers of consequence, so that there really are people to be able to write the kind of legislation and provide the dollars for us to continue our work, and that's across the board. And that's not a us against them. One of the things we have launched in Pennsylvania is the Recovery Counts Project with Faces and Voices. And what was very exciting is, as we've tried to roll this out in the 5-county Southeast Pennsylvania area, there are prevention providers that are coming on board. There are treatment providers that are coming on board. And there are recovery advocates that are coming on board. And I think that that's really what has been needed, is really a unified approach to how we're developing a constituency, because frankly, they're all our same people that we're dealing with. Okay. And just to wrap it up, Dr. Arthur Evans has gone above and beyond. Not only does he attend our functions, but he also was willing to go out and throw out the first ball at a baseball game. And then this year, we were leading up to, and I keep forgetting what it was, but we were almost in the playoffs.